Welcome back. In this video, I'll talk about the lab investigations and the treatment of lupus erythematosus. The first lab investigation that you should order for all lupus patients is of course CBC. The complete blood count will give you an idea about the RBC's involvement in the lupus patient. It will also tell you some vital information about the platelets. If the clinical findings suggest lupus and you see anemia with low platelet count, this can be suggestive of lupus. If you do erythrocyte sedimentation rate, you will see that the blood goes down rather quickly. But this isn't very specific. Most of the systemic conditions increase the erythrocyte sedimentation rate. And if you're really suspecting lupus, you should order antinuclear antibodies. Again, these are not specific for lupus, but they can be highly suggestive. If the patient's clinical scenario suggests lupus, and you see ANA with decreased hemoglobin and decreased platelets, lupus erythematosus should be at the top of your diagnosing list. And of course, you need to order liver function test as well as renal function test, as these organs are commonly affected in lupus patients. Urinalysis is also very important, as you might see early signs of proteins in the urine. And then you can move to radiology, where you need to do a chest X-ray, as well as an echocardiogram. This is done to check the pleura of the heart and to see if there is any fluid around the heart or fluid around the lungs. It's also important to create as a baseline of the patient. And if the patient is currently having inflammation signs in the skin or their kidneys, which will show signs of inflammation and indicates lupus. The treatment of lupus depends on the patient's symptoms. For most patients, the first line is the non-steroidal anti-inflammatory drugs, such as naproxen and ibuprofen. These are good at controlling the inflammation and the patient's symptoms, and their side effects are relatively smaller. And we can also use anti-malarial drugs, such as hydroxychloroquine, and this medication is very good at suppressing the immunity in lupus patients, and it can decrease the frequency of the attacks. Steroids like prednisone can be used, but they're commonly reserved for patients with higher flares or stronger symptoms. And if the patient's symptoms are very severe, of course you can use immunosuppressants such as mycophenolate, methotrexate, cyclosporine or azathioprine. These are very good at controlling the symptoms, but their side effects are very serious. So we conserve them for flare-ups that are very bad. As a final resort, we can use rituximab or some biological agents such as belimumab. The effectiveness of these medications depends on the patient. Sometimes they help, and sometimes they actually worsen the symptoms. And here's a small quiz. What is the mechanism of action of cyclosporine? And here is the answer.